Wilson Sosion. Let's get a health perspective of these recommendations and whether they're viable or not. Joining us now is Dr. Chibanzi Mwachonda, the Acting Secretary General of KMPDU, joining us now by way of Skype. Thank you very much for joining us tonight. Glad to have you here. A raft of recommendations there from the Kenya National Union of Teachers to the TSC, perhaps as bare minimum before we reopen schools. From a health perspective, what are your thoughts?
Yeah, so thank you, Akisa, for this invitation. So basically, I think that the things that you're looking at in terms of preparedness for reopening of schools are one, on the issue of occupational safety and health, and then the transmission and spread of COVID-19 amongst the schools, because globally what we have seen as evidence is that other countries that tried to reopen schools resulted in a breeding ground for COVID-19, and the result is that we had reinfections from amongst the schools. So that's what we're trying to avoid. And so basically, what the Teachers Union is trying to put across as recommendations, and partly is what we also had actually put forth when they consulted us on the issue of occupational safety and health, is ensuring that one, teachers will be protected, and the environment at work will be able to reduce the transmission and spread of the disease. And these are issues that are actually even put forth in the Occupational Safety and Health Act 2007 in our own country, where there are obligations for employers and employees with regards to the working environment at the school. The issue of ensuring that classes actually implement the social distancing measure, where we have 1 meter apart. That means that the schools have to be expanded in terms of infrastructure, in terms of employment of more teachers, and also in terms of ensuring that the students do not transmit the disease. So basically, it's around these issues, and that is where now, like, I think the recommendation on staff rooms and ensuring that teachers are provided personal protective equipment, and most importantly is ensuring that teachers are actually inducted on COVID-19. Remember, teachers will be taking care of students. Students are part of what we have as our young people in this country. And so the teachers have to be well equipped in terms of the basic knowledge on COVID-19, just to be able to know that these are the symptoms for COVID-19. And induction where they to also support some of the students psychologically, and not just when they're teaching, because remember that we are having students coming from different backgrounds. Some have actually been affected. Been affected with COVID-19.
Right.
So this raft of measures are actually what needs to be done.
Another recommendation that being made by NAT, localizing the teachers, that let teachers teach where they're home, at their homes or home areas, or where they've made home, to try and reduce the spread of transmission. Is this the best way to go about this?
Well, the first thing is to make sure that there's a discussion. I think they've put forth recommendations. So the discussion should be centered around that issue of reducing the spread and transmission of the disease. So will movement is it a risk factor to ensure to spreading the disease? As we speak currently, it is a risk factor. So then it means you have to look at the areas that actually have the high disease burden. And so now try and balance that issue of movement amongst the teachers from the different parts of the country.
We keep talking about an induction, and you've mentioned it, and it is in that report. It's been in every other report or recommendations that NAT has made. Induction of teachers, you've talked about, they need to be aware of the symptoms of COVID-19. But when we're talking about training them, what else must be included in this program, so to speak?
So for teachers, apart from the basic issues of and the basic issues of around COVID-19, the disease itself, and this one is not just for teachers, I think it should also be included in our curriculum for the students, so that they now get to learn more about pandemics and the disease that is there and the mitigation measures, that they're able to understand what it entails to protect oneself from this disease. Also training and induction on occupational safety and health for the teachers, and not just disease prevention, but even the work environment, but even what needs to be done in case perhaps you start getting, or perhaps you get one who is infected. There's a reporting mechanism for anyone who contracts an occupational disease, and COVID-19 is actually an occupational disease. So that training and induction on the reporting mechanism, and this can be done through the Directorate of Occupational Safety and Health that is actually in charge of occupational safety health matters in the country. I think thirdly, just to add, is that we have, I think, over 50,000 teachers who are above the age of 50 years who are actually who are living with comorbid conditions like diabetes, hypertension. These teachers actually need to also be inducted in terms of not just for the sake of the students, but even for the sake of themselves in terms of prevention, and perhaps even look at measures in which you can find a way of ensuring that there are high-risk individuals, yes, but how then do you reduce their risk of perhaps contracting the disease? And so that induction is important.
Dr. Mwachonda, big conversation right now on getting a certificate to state that you're COVID-19 free. There's a recommendation that all teachers should be tested. We are seeing it happen with truck drivers, but a lot of questions around how long will this certificate be valid as far as contracting the virus is concerned?
Yeah, and perhaps that's the discussion that is what we've seen even in the public spaces with regards to the COVID-19 certificate. As we know, is that once the test is done, the PCR test is done today, you turn negative, but that does not mean that 5 days or even 3 days from now, you will have actually come into contact with someone who's perhaps a COVID-19 asymptomatic individual and also contracted the disease. So this certificate is actually being mooted to be one of the areas or one of the ways in which we can now allow movement. But I think the duration should not be more than 7 to 14 days on the maximum 14 days, because then now you must be able to provide a testing period for every COVID-19 period, that COVID-19 certificate that you give, because one certificate today might not be valid 7 days from now, and I could actually have perhaps turned positive. So that's the discussion that we need to look at in terms of the validity of the certificate. And if that means, then it means we are going to take that through, then it means now we ramp up our testing capacity, because if you're looking at health workers and teachers who need testing, then basically you're saying they should be tested perhaps every 1 week or every two weeks.
So we are likely looking at a situation of constant testing for very many groups of people going forward.
Precisely, yes, especially at the workplace and those who are actually involved in this response.
Thank you very much for joining us here tonight, giving us your thoughts on those recommendations. Dr. Chibanzi Mwachonda is Acting Secretary General, KMPDU, joining us tonight as we just take a look at the raft of recommendations made by NAT to the TSC, even as the conversation around the reopening of schools continues. Remember, we'd really love to hear from you on our Big Q tonight, asking whether the restrictions should be lifted, seeing as many have gone back to business as usual, and not just to the common Kenyan, but right from the top, our leaders. We'd love to hear what you have to say about that. Big Q, I'll be sampling a number of reviews even as we continue with the bulletin tonight. Let's take a quick break.